Hello, my name's Michelle.
Michelle, do you have a mild learning disability?
Yes, I do have a mild learning disability. I've lived independently for, I moved out of my parents' home in 1985.
So what has lockdown been like for you?
Horrible. Yes.
Yeah, what's been horrible about it?
Being bored. Doing the same thing every day seems to be the same, like you forget what day it is because every day seems to, like, at least when you go out, you know, like, oh today is like Monday, or oh no, it's Tuesday because you got music or you've got art, or Wednesday is like book club, or you might have training.
Yeah.
You know, or Friday you've got drumming and then yoga.
Yeah. You have been doing some things over Zoom though, haven't you?
But you know, lockdown, I have had the Zoom, as you've just mentioned, where I've done the quizzes on a Tuesday afternoon.
Yeah, with Generate.
With Generate, yes. I've started doing the art on Zoom on a Thursday morning.
Yeah.
And then the Generate Zoom on a Friday lunchtime.
Yeah.
And then a chat and brew in the afternoon with another group.
Yeah, that's with Paradigm, isn't it?
Yes.
But you told me last time you've also been baking.
Yes. I've baked a cake. What else have I done? Oh, I've also done some with the art pack that we were given from Melanie at the art group. There was one of the recipes and that with salt dough. I've made a couple of models, and I've also attempted to do a sculpture, but I've still got to paint them.
So why have you been shielding?
Because I've got underlying health issues that I have because I'm asthmatic, and I'm also epileptic.
Yeah. So somebody else has been doing your shopping, is that right?
Yes, member of staff from Generate.
Have you been out at all in the last few weeks?
I have been out just a little bit, just for like to the local shop that's on my complex, and that for a little bit of exercise and that. But I've been a bit very nervous, because even though you have the 2 meter restrictions, people don't abide by them. I have my own mask, and I have this hat that has a shield.
Yeah.
And I have surgical gloves as well. I had a text message from my GP about my asthma check, and I had to do the link about doing this survey, sort of like a link to seeing how my asthma thing, but because I couldn't get onto the link through my and that, so I phoned up my GP, and one of the nurses phoned me back, and we had a bit of a discussion about my asthma, and so she got the doctor to call me.
Yeah.
So the doctor called me, and like I explained to her about the cupboard and that about the mold and all that. So the doctor, my Dr. Taylor, she increased my Seretide. So I have to have 2 puffs of that in the morning and 2 puffs of it of a night. But I also have to take the Ventolin as well on top.
So is that a checkup that normally you would have had in the doctor's your asthma review, but you had to do it over the phone?
Yes. Yes. But she also said that she would call me again in 2 weeks' time to see how I was going after the increase of the Seretide and that, which she did. Then I had another call from another nurse from the surgery to see how I am, how I'm doing, with just generally with my health and my asthma and all that, and that Dr. Taylor again will be calling me on the 12th, I think she said, which is in 2 more days, to see how I am.
So you've had lots of support from your doctors since you've been self-isolating. That's good.
Yeah. I have a good relationship with my doctors. I've been with the GPs for 16 and a half years. Different doctors and that, but the care from each doctor is one of the doctors that left. I had a really good support. Before she left, she actually phoned me up and said that she checked me up on my medication. She took me off 2 of them that I didn't necessarily need to stay on them and that, and she actually said, I'm just phoning up also to wish you all the best, and that I'm actually leaving. This is my last day, and all the best for the future, and take heart. And that in my earlier times, I've had bad experiences with doctors.
So what do the bad ones do? Like,
they don't listen. They like especially at the hospital, the consultants, like when they're trying to tell you something or explain, but they're like they're standing up, like they're ready for you to go, like up.
Can't wait to get on with it.
And I had a support worker, but she was quite a senior support worker.
Yeah.
And so they so they sort of like said, well, can you explain a bit more rather than trying to rush us out the door?